right, let's call this meeting to order. Are there anybody sign up for public comments?
No, sir.
Thank you. We need to approve the minutes, which I had seen already online and in our email.
Yep. Move to approve.
I have a motion
Second.
and a second. Call the roll.
Mr. Hayes?
Aye.
Ms. Lynn? Aye. Mr. Lynch?
Aye.
Ms. Smith? Chair Montgomery?
Aye. Okay, now we are, Angela has put together a panel discussion that we had mentioned last meeting. And so I will turn it over to you to help facilitate this.
You bet. At our last meeting, one of the things that we talked about was the benefit of hearing from some folks that are actually in our community, working with some of the folks in need, working with a lot of the nonprofits that are applying to this group, and let you hear directly from them about their experiences. Kristen Swan with United Way is going to kick us off with a presentation, and then we'll go more into a panel discussion with the rest of our guests from Murfreesboro Police, Murfreesboro City School, and Recreation Services.
Thank you guys so much for having us. It's always an honor to share just some of the things going on in the community. Angela, we have been working for a while with the city to provide them with some different data points, and so I just wanted to share that with you guys today. So United Way really looks at kind of a big picture view of our community, and so we have a lot of high-level data that I want to share with you guys today. So the first piece of information, you guys may know this acronym or you may not, is ALICE. So ALICE stands for Asset Limited, Income Constrained, and Employed. And this is a study that we have all over the state of Tennessee. It's actually a national study that's done by United Ways all over the country. But really what this study looks at are folks in our community that are working but are still unable to live at the true cost of living. And so I wanted to share some of that data with you today. So in Rutherford County, the folks below the ALICE threshold, so this includes people that are above the below the federal poverty line as well as above the federal poverty line but are still not able to make ends meet in Rutherford County, represents 43% of those living in Rutherford County. And I will back up just a little bit to let you know kind of the genesis of this study. And so it was started by an economics professor from Rutgers University who really saw this phenomenon that a lot of us who kind of serve folks in our community see every day, which is the federal poverty line has not changed since the 1970s. And my colleague Ella Weaver is here, so if I say something wrong, please throw a pin at me. But the federal poverty line has not changed, and it does not matter where you live, the federal poverty line is the same. So if you live in Los Angeles, California, or if you live in Woodbury, Tennessee, the federal poverty line is the same. And so what this data looks at is the true cost of living. So if you've ever heard of the COLI index, the cost of living index, and then it also looks at data from the census. So it's looking at what people are earning, and then it compares that data versus the true cost of living. And what we see is there really is a discrepancy between what it actually costs to live in Rutherford County and that gap between the federal poverty line and that threshold for ALICE. Why that matters is the federal poverty line is what's used to determine a lot of benefits. Right? And so we have folks that do not qualify for any type of state or federal benefits, but are still struggling to live in Rutherford County. So 43% in Rutherford and Murfreesboro, proper, the city of Murfreesboro, 46% are at the ALICE threshold or below, and in the zip code 37130, which I'm not sure if we're in that zip code right now, but this would represent kind of the downtown Murfreesboro area, it's 57% are at the ALICE threshold or below. One of the things that I like to point out is I think sometimes when we think about homelessness or we think about people who are experiencing, who are unhoused in our community, we think about the folks kind of living under the bridge or at the Salvation Army or things like that. But we work with our local legal aid society often to get an estimate of evictions that are performed in Rutherford County every year. This is somewhat of a tricky number to get. You would think it would be a little bit easier, but they go to civil court every Friday, and this is where where most evictions are kind of seen by that court. And we estimate there are about 12,000 evictions in Rutherford County every year. Why this is significant is we know that folks that are in Alice, they are very unstable. And so a lot of times what happens, and we get these phone calls all the time, anyone that serves in our community get these phone calls all the time. These are families that, again, are working. One thing has happened, and they really find themselves in a time of crisis, and that downward spiral can be quick and it can be devastating for a family. So 12,000 evictions in Rutherford County every year. When we think about the school systems, I'm glad Murfreesboro City School is here today to kind of talk about this, but when we think about McKinney-Vento data, so McKinney-Vento is a foundational federal law of the United States that provides assistance for children and youth experiencing homelessness, ensuring their education rights and stability. So the McKinney-Vento definition and the HUD definition of homelessness are not the same. So when we think about the McKinney-Vento definition, these are children that are without stable housing. They could be couch surfing, they could be in a hotel or a motel, but to kind of look at that against what HUD says homelessness is literal homelessness, right? So where someone's living in a place not meant for human habitation, in a car, outside, in a shelter. But McKinney-Vento definition is a little bit more broad in that the family, the child, does not have stable housing, and therefore they're moving around a lot. One of the really important things that McKinney-Vento liaisons do in both of our school systems is they provide transportation to the child's school of origin so that they can have some stability with their education. So they do a lot of different things. They provide basic needs for the kids. But I wanted to point out kind of the difference. The McKinney-Vento numbers, the school year ending in 2024, Murfreesboro City had 339. As year to date, and I will say this number is probably about a month old now, so it's probably higher, is 196. For Rutherford County, they ended the school year last year with 2,243 children that were identified as McKinney-Vento, and year to date, again, as of maybe three or 4 weeks ago, they were at 900, and they enroll these children all year long. So by the time we get to the end of this school year, that number certainly will grow. All right. Another service that United Way provides is our 211 service. So if you're not familiar with 211, this is a national number. It's a first call for help, and it's a database of local resources that folks can call and kind of see, if they need help with housing, they need help with rent, utilities, anything, they can call this number and get help in our community. And so because of that service that United Way provides, we have data to show who's calling, where they're calling from, and what they're calling about. So just to share a little bit about that, for the last fiscal year, so United Way operates on a July to June fiscal year, so that's just kind of how I think about numbers. But for the last fiscal year in the Rutherford County School District, we had a little over 3,500 calls to 211. In the Murfreesboro City School District, we had 2,086 calls. The reason I did this by district is because the data is processed by county, by congressional district, or by school district. So I didn't have the actual Murfreesboro City. So I wanted to show you Murfreesboro City School District versus Rutherford County School District. So you can see that's quite a few calls. And then looking at a breakdown of those calls from the 24-25 fiscal year, 51% of those calls were about housing and shelter. And as someone who has worked at United Way for 12, almost 13 years now, I can tell you this is absolutely accurate. I mean, almost every phone call that I answer that is someone looking for help is usually for housing. When we look at the housing numbers, so that 51% of the pie, and this is just Murfreesboro City School District for last fiscal year. When we look at that 51%, 53% of those housing-specific requests were for rent assistance. And so again, I think this goes back to just kind of reinforce that data that I showed you earlier, that we have 12,000 evictions in Rutherford County every year. Oftentimes, again, these are working families who something has happened. And I will say, just to go back to that Alice data, that 56% or whatever it was in Murfreesboro, maybe 57, that budget is a survival budget only. And so that's why we see so many families in this category, is because they are surviving. There is no room in that budget for savings. There is Alice data that will show kind of what the stability budget is. That does account for savings for a family, but those numbers are survival numbers, meaning they are just living in Rutherford County. That's it. They're not able to plan for their futures. They're not able to save and things like that. So I bring that up because oftentimes what we see happening is, again, one crisis, one medical crisis, one flat tire, one whatever, and, a family is unhoused in a matter of months. Any questions? I feel like I'm going really fast, talking a lot. Okay. Yes, sir.
My curiosity is, are there particular schools that you see more 211 calls from?
So I don't have the data that granularly, but we can look at it by zip code. So if there are specific zip codes that you guys would like to look at, and this data, I can send it to Angela. It is publicly available, so you can slice and dice it however you want to look. But I think it's zip code, school district, county, and congressional district, I think, are the ways that they look at it. Is that right, Ella? So we can't look at particular schools, but we could look at different zip codes.
So in my experience, my data I had from a while ago, the majority of Murfreesboro city schools are low income. You have some outliers, but hardly any. It's almost all schools. That may have changed, I don't know.
Your identifier for looking at schools would be Title I designation. So nine of our schools out of 15 are designated Title I. So knowing that you could have students that are doing well, but also categorized in Title I sense, where they're getting free and reduced lunch, free lunch and other things like that as well. So that would be a good lens to look at.
Any other questions? Okay. So another system that United Way provides here locally is called Charity Tracker. And so this is a database that agencies can use. It's not a requirement, but they can use it to track their services in the community. So we have a lot of folks that use it for case management. And so they're putting in there the type of assistances that they're recording for folks, and they're putting in there, the amount of assistance that they're providing to people. So I did want to provide that data for what we have out of Charity Tracker. For last fiscal year, there was $1.9 million of assistance recorded in Charity Tracker, and that represented 87,559 assistance records. And of those assistance records, you can see 39% were for food and 18% were for household items. And so a lot of times what we're seeing, again, are people in crisis because they are, again, in that ALICE threshold, something happens and they find themselves in crisis. And so, Charity Tracker, certainly the data has its limitations, right? Because it's not a requirement. Folks are using it kind of as they see fit in their agency. But I did want to provide that because that's kind of real-time data. Again, $1.9 million in assistance provided. And then what was that? little over 87,000 assistance records. All right, so our continuum of care are all of the agencies in Rutherford County that serve those experiencing homelessness. And so lots of agencies that you guys are probably familiar with are part of the COC, the Journey Home, Salvation Army, Stepping Stones, the list goes on, domestic violence, Murfreesboro Coal Patrol are all kind of part of that continuum of care. And so with the continuum of care, that group of agencies is looking at data from an annual basis through what's called the HMIS system, the Homeless Management Information System. Now, I will say one limitation with this data is that it is folks that are required to put that information in HMIS because they have some type of HUD funding. So not every single agency is putting everything in there, but I did want to provide that information that we do have for you guys. So the point in time count is done every year, and I believe Officer Wood is very involved with that every year. And so for you guys, this is a national count that's done all over the country in January. It's done the same day or the same weekend of every year. And they count folks that are experiencing literal homelessness. So you can see what that includes. So individuals that are sheltered in emergency shelters, transitional housing, unsheltered individuals on streets, cars, or other places not meant for human habitation. So again, you can see that difference of the definition that HUD uses versus the difference that McKinney-Vento and the school systems use. Last year in 2025, I guess this year technically, this past January, we counted 349 folks in Rutherford County that met that definition on that night. And in 2024, we counted 367 individuals. So you can see not a huge difference. Again, there are always limitations to things like this, but the reason it's done the same night of every year so that we can have some type of comparison year to year. This number is important because it's reported back to HUD, so that they know kind of who we're serving and how many folks are in our community that meet that HUD definition. And it does have some implications on funding for our community. Again, this is a little bit more HMIS data. So we look at annual enrollment counts. So these are active enrollments in the different programs that are recorded into HMIS. And so you can see a pretty big bump there 4 years ago, 3 years ago. And then you can see the current year, that number was 908 as of September, and so we just kind of extrapolated a little bit, and an estimate of 1,300 folks will be served through the HMIS system in 2025 if we keep up with the same rate as we are right now. Y'all feel free to stop me if you have any questions. Again, this is a person served in the last year, so this is a calendar year, which is a little bit different than the data that I shared, but there are 457 households served through HMIS programs, and that looked at 791 clients. Now, the reason that number is different is because obviously a household can have many members, and so the households were 457, the individual clients were 791, and the enrollment count is even higher because oftentimes we will see one household that has multiple enrollments, right? So let's say that someone is literally homeless and Murfreesboro City, Murfreesboro Coal Patrol comes across them and they enroll them in a program. Well, then they're able to get to shelter, so they go to Salvation Army, that's another enrollment. Then they're able to get to transitional housing, they work with Journey Home or someone like that, that's another enrollment. So that one family could have 3 enrollments. That's why that enrollment number is a little bit higher than the household and client number. Here you can see the monthly entry exits. The reason the month of April is a lot higher as far as the entries go, and the December and January are higher as far as entries, and then April is higher as far as exits, is because we do have a cold weather shelter here that's run by the Journey Home, and those folks are entering a program and they are exiting in April because that's when the cold weather shelter normally ends. So that's why that looks a little bit different. But the other months you can see it's pretty close to entries and exits in the different programs that are recorded in HMIS. This is something I think is really interesting for you guys to know and to look at. So of all of those programs that are recording folks that they're serving, the exit destinations, 26% returned to homelessness, 24% stayed with friends and family, and 17% were able to go onto a rental that they were renting themselves. Again, one caveat with that 26% return to homelessness, that does include the numbers for the Coldest Night shelter program. So a lot of those folks are just getting emergency shelter and they're, exiting to homelessness when that program is over. You can see the exit destinations by agency. So below are the agencies that are recording their information in HMIS. So you've got Murfreesboro Coal Patrol, Murfreesboro Housing Authority, Stepping Stones, the Journey Home Coldest Night Shelter, which we separated because of the uniqueness of that, the Salvation Army, and Volunteer Behavioral Health. So you can see the blue is folks that exited the program to either shelter or housing, so they did not return to homelessness, they either went to shelter or housing. The red are those who exited to homelessness, and that's where you can see that large number with the Coldest Nights. I will point out this yellow, returning to jail or the hospital. So when folks exit the program, they record where they went, no matter where that is. And so sometimes they are going to jail, and sometimes they are going to the hospital. But I will tell you from this data set, one person went to the hospital from this entire data set, and 6 people were actually deceased. So if that gives you any kind of understanding of the volume that we're looking at, it's not very high. And then the green was other. In 2023, this represents about 1,400 cases in our HMIS system. 37% were children, 63% were adults. And one thing that I like to point out is only 7% of that 1,400 individuals or cases recorded in HMIS were chronically homeless, which means they were homeless for more than a year. That is self-reported. So someone will report when they do an assessment and they're taken into the system that, I've been homeless for more than a year, or I've been homeless over the past 4 years for a year total. So that's what HUD deems chronically homeless, and 3% were veterans. In 2024, we see very similar statistics: 28% children, 72% adults, again, 7% chronically homeless, and 5% veterans. The last slide I have is a little bit about Access Rutherford. So these are agencies that are doing assessments as part of the coordinated entry system. And so our community has one assessment that these agencies can perform so that a person is not having to go to several different agencies and fill out paperwork. If they do the one assessment, they kind of get put on the prioritization list. And why I think that's important for this group to know is, as of probably about 3 weeks ago, we had 232 people on the active list, 157 households on that active list. So just to give you some numbers, I wanted to show kind of the difference between kind of that ALICE population and the folks that we're serving who are chronically homeless or represented in our HMIS. You can really see the difference there. We're talking about hundreds of thousands of people in Rutherford County that are in ALICE. And certainly, like I said, depending on which data set you look at, our PIT count is a little over 300. So I think it's just important to remember that we do have a lot of people that are chronically experiencing homelessness or in more of this crisis state, but we also have a lot more families that are unstable financially in our community. So, any questions for me? All right. Thank you guys so much.
Thank you for the presentation. That was very, very good, very informative. All right, Angela, how do you want to proceed?
If I could just start with Captain Anderson and give these folks some time to introduce themselves and tell us what you do.
My name is Brian Anderson. I'm a patrol captain for the police department. My duties, there's 3 patrol captains, so my duties there, traffic and special services. Special services encompasses the host unit, which is Sergeant Wood's unit, which is the homeless outreach support team.
I'm Ken Roach. I'm an assistant superintendent with Murfreesboro City Schools. I oversee all things student-related that are not academic, so federal programs, coordinated school health, behavior, attendance, enrollment, to name a few, and then our McKinney-Vento students as well.
Sergeant Mark Wood. I'm over the host unit here at the police department.
My name is Nate Williams. I'm the Executive Director of Recreation Services for the City of Murfreesboro. I oversee Parks and Recreation and golf departments.
Great. If we could, I just wanted to open it up, kind of question-answer piece. If this group would like to see what kind of information would help you make good decisions. This group will be receiving applications from nonprofits in Murfreesboro from all kinds of different areas, and we're making funding decisions coming up here very soon. So any questions for this group about things that they see through the course of their workday and time in Murfreesboro?
Go ahead.
So any of you can answer. I'm Collier Smith. Nice to meet you all. We struggle as a group because we all represent different charities that we've worked with. So we have, some are much more obvious to the others. Does that, so when you are on the street and you are seeing people that need help, what are the charities that you have seen that step up on a day-to-day basis?
I defer to Sergeant Wood, but I think that's overwhelming. Coal Patrol is who it is for us, but I'll let you in the weeds.
Coal Patrol will come to us. They're more of an outreach. So no matter where we're at, we can call them and they meet us there. But I mean, we use all of them. I mean, stepping stones. I have a female officer that I normally let. She handles most of the stepping stone stuff just because it's females. But Stepping Stone, Salvation Army, we use them all. Coal Patrol is just, like I said, they will come to us and meet us halfway at least. So
And I will
probably,
yeah, go ahead.
I mean, we use them definitely. And they help with everything from rehabs, IDs, all the things that that we need to help people with, so.
And just so everybody knows, in the past, the Journey Home meetings, 6 months, I'd say 6, 7 months, that relationship has got a lot better. There's a lot of change there for the better. When the vision of their outreach has changed as well, so that's helping.
Oh, the call.
I can say us a whole lot.
I'll give more detail on that. The mayor asked us to meet with the Journey Home back in June, with the main concerns that Murfreesboro was becoming a destination for homelessness for the way they were providing services and just feeding people. And a lot of credit to that organization led by Leslie Dodd, who created an accountability committee and completely changed their operation as they've led into their new building. And we've seen their building opening with the changes. And I think it's beyond what we could have ever expected as far as, their commitment to make it where Murfreesboro is not a destination for homelessness. So I think a lot of credit to them, to listening and partnering with us has been tremendous for the community.
They're actually holding, instead of just being a place to eat, get laundry done, shower, the new building's allowing them to provide services where when you come in, you have to pick a pathway of what you need. If it's rehoming, if it's mental issues, if it's actual illness issues, they have staff on to do all that. And if you don't participate in that in the first 30 days, then their services are no longer allowed. So you have to be able to pick a path with them to get services to get themselves back on their feet.
And prioritizing local residents of Murfreesboro and Rutherford County as the first to get services, rather than just anybody can come from Metro or further away to get services.
Sergeant Wood was seeing new people every day that were coming from other cities here, either by hitchhiking, Greyhound, or whatever. So, it was daily new people from different cities. So they've also, like Nate said, it's Murfreesboro, Rutherford County residents.
And our call volume's dropped.
In the what drop?
75%. Our call volume, my officers used to sit there half the day.
Yeah.
The old building.
At the old building. We were pretty much giving them free security.
I think it's unique what we've seen since June. We've all been part of a situation where we've had to address an issue between two organizations, and the level of commitment that's happened since June is just unlike anything I've ever seen from their side, and they're relentless in not letting up either.
Even with staffing changes, they got rid of a lot of staff and rehired new people that are of the same mindset. So it's been great.
Excellent.
I'll go next. I'm Wade Hayes. Nice to meet you guys. Thanks for coming today. And now that we're on this subject that we're on, I've got a couple questions, but this particular subject, maybe not necessarily homelessness or eviction type problems, but just in general, the needy kids, and we're talking, this group is strictly Murfreesboro, Tennessee, the border of Murfreesboro. And so within the city, what one or two organizations really helps kids just in general, needy kids, one-parent kids, whatever the case may be that you guys observe?
We have a grant with United Way, Pole Patrol, Stepping Stones, and Salvation Army.
Okay.
So I met with their social workers last year, the grants with all of us. If they have a child that they think is living in a car or outside, we don't deal with hotels as much as if they're in a hotel, they're under a roof. So my crew, we don't do that. But we have this grant, and most of the time they contact Pole Patrol, the social workers with. So either me or the social workers. But we met with them, and the grant's over a year old. Do you know for sure?
I think you guys are in your second year.
So we've had, it's not just for that, but we use it. The grant is for, it's got to be kids or medical conditions. So that's what the grant's for.
Okay.
We've used it quite a bit.
From a school perspective, I'm sure there's a lot more organizations that I would think of, but top three, United Way, not just because you're in the room, Journey Homes, and then Greenhouse Ministries. There's other organizations that we work with. We're fortunate to have 5 social workers, and then we partner with Family Family Preservation Initiative as well. So they provide additional resources, and we look at anything that families need we're assisting with. So when they're going to motels, those federal funds are providing money for families to be in motels.
We get a lot of organizations that are after-school type programs for kids that need a place to go. And then that's another need that, that we're trying to fulfill as well. So maybe not, and these kids may not be homeless, they just keep them out of trouble type deal. Is there anything?
Yeah, we have several that we work with within the parks. Most of them are local churches. I think of First Baptist Castle Street does a tremendous amount of work to help us. First Shot, it works with us throughout the course of the year, does fall camps for us and spring break camps, and provides a couple of meals through the year. But outside of that, we have larger organizations like the Tennessee Golf Foundation that works with golf to help supplement some of the costs and everything that happened.
We have organizations that push into extended school programs. So we have 2,000 students that participate out of 9,000 kids. That's at most of our schools. That's a feature that Murfreesboro City Schools has that Rutherford County Schools does not. It's the reason why a lot of our families stay with us when they look at that transition of 5th grade to 6th grade and where they're going to decide to go.
Yeah.
We have a lot of people and organizations that push into that program as well.
Thanks.
So I'm Lynn, and I think you're with traffic. I hope you don't know my name, but it wasn't me. So when you find homeless children, how do you get them back into the school system? Because they don't have any way to get there. So how does that work?
So I think the most important part is when you look at McKinney-Vento, based on lots about stability. So we have, when our students come in and they check in with us, we have our staff that's available. We have our multifamily lingual liaisons. So Spanish is our second most spoken language, and then Arabic. So depending on when they come into the office, we normally have one of our staff members that's assisting either by phone or by sometimes FaceTime. And it's a matter of just making sure that we talk with the family. There's a series of questions that we ask based on the certification of McKinney-Vento. And then based on that, we provide transportation and then family resources to them as well.
So you do provide the logistics of getting kids to school,
That is
lunch,
correct. Yeah, so
breakfast, lunch?
we do. So actually, we're a CEP, and I'm forgetting what that acronym stands for, but every student in Murfreesboro schools gets a free lunch right now. So that's something that may change based on federal funding. This year, we anticipated title funding to drop. We actually saw an increase, so we just don't know. So I think there's just a lot that's to be said about what's in the news, but we're seeing that there's stable funding. Next year, we do anticipate a slight decrease in Title I, but really it's a matter of just providing the students with support. So we use our agencies that we work with outside of our district to provide extra support. And really with the 189 students we have right now classified as McKinney-Vento, we have a liaison, our counselors, and others reach out. So we have our backpack program on the weekend. We have about 986 families that get weekend backpack programs, and we serve 2 million meals a school year as well.
On that program, does that provide just the meal for the child, or is that enough for the family, or the mom or dad, or both?
It is not enough food.
Okay.
So that-
Thank you.
My name's Lyle Lynch, and I've got a question for the police department. What's the current policy if law enforcement encounters a impromptu homeless encampment, both on public property, and the same question would apply to private property?
So this is, again, the expert, Sergeant Wood, is there, and I'll let him fill in with the gaps that I mess up. But right now, I just pulled, we did Lieutenant Luter, who's in another meeting, but in between me and him, did a dashboard from July 1st till September 30th. And his unit, which is 3 officers and him right now, in that 3-month period, in that quarter, had 896 contacts with unsheltered individuals. They cleared 34 camps and identified 27 new ones. So when we mean by cleared, if it's on, he has a whole GIS map that the GIS folks have done that's identified properties that are either city property or if it's private property, then, and we have a homeless issue, then he'll reach out to them and say, do you need our help? And if they say yes, they provide a letter that states they don't want anybody loitering, camping, or trespassing on their property. That letter is emailed to him, me, or Lieutenant Luter. It goes to dispatch, so it's attached to that address. So if officers go out there, they can say, is there no trespassing letter on file? Dispatch can pull that attachment to that address and say yes or no. If that is there and it's a camp that he gives, it's still 48 hours, correct? 72-hour notice to the people on that property.
And that's private property.
On private property. So they get a 72-hour notice. They go out there, 72 hours, you could be subject to a citation for trespassing, and almost all the time, that fixes the issue. They do go back and follow up after those 72 hours, and if people are still there, then they can be issued a citation for trespassing.
And some of those camps are the same, like we'll clear a camp and somebody else will move into it. So I've cleared the same piece of property 20 times.
Perfect example, most of you are familiar on the College Street side of the back parking lot of Demas's. There's a lot back there that kind of backs up to, is that not Forest Rosecrans? It backs up to, what's the name of the road?
Rosebanks.
Rosebanks, thank you. There's a small couple of acre parcel there that a very elderly woman here in town owned. She worked with us, gave us a letter. We were able to keep it clear. She passed away and left that to her caretaker, left that piece of property to her caretaker, who really didn't know what to do with it. Luckily, she hired some attorneys to help her try to sell that. But in the meantime, people moved back in. Well, the letter was no longer good. So then we had to get with her. She didn't really know what to do. The attorney finally drew up a letter saying that we could vacate, this, that, and the other. It was an ongoing thing for a while. But long story short, she actually took our advice and got a land management company in there to undercut all the brush, and so that usually solves it. So they went in there and bush hogged everything and got it, and so that has fixed the problem. But that was a 3-week process probably, if not longer. So I mean that's yeah, that's how it when we have issues like that. I mean that was a complex one, but still that's what we have to deal with.
Here's a resource question. How many officers then on MPD are dedicated to addressing homelessness?
Currently 4 and 3 2 co-responders, which is the social workers, but there actually is a letter out to add 3 more right now. So they're interviewing to add 3 more to work the evening shift.
Wow. I didn't know that.
2 more resource questions from me. Outside of Murfreesboro City Schools, where do people get their food? Where do y'all see the food coming from for the homeless people? They journey home? I mean, okay, is there any other?
Everywhere.
There's nobody, I can promise you, there's nobody going hungry.
No, you're not starving in Murfreesboro.
Okay, and
When we
if
go in
you-
these camps, Collier, there'll be trays and platters of food where people think that's the only thing that they can contribute, and it's just a false premise. There's food galore.
There was about a couple years ago, our Continuum of Care did kind of an unofficial study, if you will, and they found that you could, if you wanted to eat every breakfast, lunch, and dinner for free, you could do that 19 times in a row without duplicating the same service.
19 days.
I'm sorry, 19 days in a row, without duplicating. So that's how many people are providing meals.
And what about mental health? Who's the go-to?
Volunteer Behavioral Health. Volunteer Behavioral Health has got a new office over kind of behind the sleep center by the fountains over there.
1504 Williams.
Told you he's the expert. 1504 Williams. But they have partnered with us in grants, and I think Karen's worked with that, and we now have 3 full-time co-responders that ride with our officers. They wear a vest. They wear, they don't have a uniform, but they have a vest, and it says co-responder and their first name on it. The back says co-responder, and they ride with our officers every day. Well, 4 days a week, 4 or 5 days a week.
Is this like in a crisis, and there are psychologists, or there's something? What program is that? Or does it have to be homeless or just a domestic call?
2 are assigned to the homeless, and 1 is assigned to anything else. But what happens a lot of times is if they're on a domestic call and they're needed, then his folks will go to them. So they can write what we call a 6401 or a 6404, which is, you have to go into the hospital to be seen. An 01 is just to be checked by the guidance center, and a 04 mark the difference. They can
Oh, they have
admit
to
them.
they have to be seen before they can be released by an
But they
official.
kind of try to
It's
deflate
just-
the,
They've actually worked on barricaded subjects and hostage rescues with us. I mean, they have got on the phone and talked to people. One of them has been through the FBI hostage negotiator class.
and what program does it fall under too? Is there a certain one?
Karen?
So it's, the co-responders are actual employees of Volunteer Behavioral Health, and then they're embedded with the police department through the host team. So that's how it follows or trickles down.
They're grant funded through VBH. That's who pays them. They don't.
Yeah. We have the city has a sub-recipient agreement with Volunteer Behavioral Health, so we hold the grant funds and then pay them for those services.
They also, in the last year, have opened a crisis stabilization unit at the Williams address. So it's volunteer only, of course, but if somebody's in crisis, mental health crisis, if they're in addiction crisis, alcohol or opiates or any kind of drugs, they will house them. It's a 7-day, I think, is it 7?
It's 5 to 7. They do detox now. When it started, it wasn't detox,
Right.
but it's detox or crisis now.
Very beautiful new building, all free. You can go in there, and it's kind of like, I'm just going to put it bluntly, it's padded furniture, and there's nothing that you can pick up and throw around, but it's a nice dormitory, nice kitchen, nice TVs, living room areas, all that stuff. They can go there for free.
How long can they stay?
5 to 7. 5 to 7 days.
And what was the name of this?
It's through Volunteer Behavioral Health, but they call it the Crisis Stabilization Unit.
From the school side, we have one volunteer behavior health in one of our schools. We have STARS counselors and then Centerstone. And so every building has a mental health therapist that's provided. So we provide school guidance counselors, and then we provide the subcontract out that's working with their families and in-house support. One of the biggest needs that we're seeing is while our enrollment is decreasing slightly, the needs of our students are increasing. That goes with our families as well. And the number one roadblock, one of the things I oversee is mental health as well for our school district. And we're finding that when families and kids need beds, there's not enough. So there's Trust Point, but we have kids moving to Jackson. We have some kids going to Ohio, some kids to Georgia in some cases, but there's really not enough beds and not enough support for their needs at this time. That's one of our number one biggest needs.
Do y'all have a psychiatrist that you've subcontracted?
We do have school psychologists.
A psychologist?
Yes.
Okay, but who determines who stays 5 days and 7 days and who discharges?
So when they're working and we're using youth villages as our primary source for those assessments, and then when they go to the facility, they have the further assessment. So it's not the school that's.
I know by a subcontracted person.
It's the psychologist, the doctor, depending on where they're being seen.
On the adult side, Trust Point for us is a great resource, but it's only if you have insurance. So you can put that together. So other than that, it's St. Thomas Rutherford, and then if they meet the threshold after that, they could get sent to MTMHI, which is very unlikely that there's going to be an open bed, or Sergeant Wood can work through his resources and try to find somewhere for him to go, and that would be through Coal Patrol or any of the ones we've already talked about.
I'm Carl Montgomery. Sergeant Wood, you had mentioned earlier about the Journey Home deal and maybe the influx of out-of-town people being, did you say that has dropped off? Are y'all seeing a decrease in out-of-town homeless people come into our community, or has it changed, or?
Maybe, we're still seeing some come in, but not what we were seeing
Okay.
6 weeks ago.
Yeah, I would say when you look at it, people were coming here and immediately, because word had spread about you could just go eat with no other obligation at the Journey Home. Now, if you get services of the Journey Home, you have to participate in their program, their counseling program, the whole thing. There's a certain level of behavioral expectations that they're getting reports from our police department now. So we're seeing the benefit of it, I think, across the
slowly.
board. It's just going to take more time to see the data kind of follow that up once word spreads more. The benefit for us that we have now is that Journey Home is really holding to their commitment of accountability when it comes to that.
Well, the Journey Home was the only real resource in Rutherford County. So I was getting Smyrna, Laverne, everybody was bringing them here. Because they'd get out with a homeless person and I need resources. We'll get you to the Journey Home. I mean, I've watched Smyrna patrol cars drop people off at the Journey Home.
Wow.
So,
And it's still a work in progress with them. We're very pleased with what's happened since June. I mean, I was almost surprised, but their level of commitment has been bar none as far as what they've listened to and reacted to as well.
I think the exact words that Ms. Dodd said is, so you're saying that we're enabling and not fixing the problem, and that's what that was the words out of her mouth.
I think several of these nonprofits could take a page out of that playbook.
Well, I think we have a model right now, and, when we can address a concern and discuss it, I think we can.
Yeah, I think that would be great. Also, I want to give you kudos to the foot patrol on the square. I think that's awesome.
Yeah, so you were talking about the host unit. We also have 3 officers assigned to City Hall. They're either assigned inside of City Hall or patrol the outside area, and then we have one assigned to a downtown mobile patrol for this issue. So he's mobile in his unit. And then just to let you guys know, every 2 hours, it's officers that are normally working a zone are pulled randomly by a scheduling software, and they walk, or depending on whether walk or ride downtown. So that's my first every morning when I leave. I ride those areas, and I think in the last 6 weeks, I hope it's not me just being jaded. Everybody's seeing a difference in those areas for sure. So.
Anybody else?
If I can, I'm sorry.
Yeah, so we got a ton of data on all the problems and the levels and the percentage. Does anybody, whether it be you guys or the locals or federal government, is there a measure of successful communities that take care of all these problems? Or just, you just see the enrollment go down? I mean, there's no,
There are definitely best practices, I would say. So United Way, one of the unique positions we have is that there are United Ways all over the country. And so one of the programs that we have at our United Way is called Launch Point, which is a program that we work with a lot of local churches. So when folks when they are in crisis, that's when they're going to reach out, right? Most people don't I'm doing great, I just want help with my budget.
Yeah.
They're not going to do that. And so most people, the numbers that I showed you about 211, that's usually when people enter, right? They either need food or they need housing, they need some type of basic need. And so what we've done is partnered with local churches specifically and local employers to help our ALICE population, which is when they are experiencing some type of crisis, we have coaches on our team that can walk with them for up to 18 months to help them become stable. I will not say that that's the be-all, end-all answer. It's very limited, right? Because we only have so many people that can do that. But I would say looking at continuums of care or looking at different ways that we can connect resources, that we can connect families to different resources. A lot of times it's not actually a lack of resources. And yes, there is definitely a lack of resources, as these gentlemen pointed out. But one of the things that I think we can look at is how are we connecting people to resources? How do they know about what's available to them, right? And so I'm probably not specifically answering your question, Mr. Hayes, but I do feel like that is something that this community could do a better job of connecting the dots for people. When someone calls our office and they're in crisis, the first thing they say is, I'm Wade and I need help with housing and I have no idea what to do. Right? Because most people that are in crisis, unless they have kind of been in that cycle for a long time, really don't know how to access the system. And so there ends up being a lot of duplication, a lot of confusion and things like that. So that's one of the things that our United Way is specifically looking at is how can we utilize 211 to connect people to resources? How can we utilize programs like LaunchPoint and other programs that we have? So that was probably a non-answer, but.
No, it is. And 211 sounds like a great solution to bring everything, if everyone would participate in that.
And it's, of course, it has its limitations, and it's not perfect either. But I will tell you, very recently, our state, so everyone, we had several different 211 systems, Chattanooga, Knoxville, us, Memphis, West Tennessee. They've all gotten on the same platform so that we have kind of connectivity across the state. So that's, we're hoping that it will become more robust as it.
So is 211 proprietary to United Way?
It is, yeah.
Okay, wow. That's awesome.
Do you see any fraud much in that with people that don't need the 211 deal, but they're taking advantage of it?
So 211 is really just a directory,
Okay.
right? So like people, it's kind of a first call for help. Like if you experience something and you have no idea what to do, call 211. And they have folks that can answer, they are trained in motivational interviewing. So they ask people questions, what's going on? Is it just housing? Do you also need resources for your children? Do you need mental health resources? They're also trained in suicidology as well as de-escalation tactics. And so it's hard for me to say if there's fraud happening because it's really a first call for help. It's, I don't know where to go, so I'm going to call 211 and that's going to get me to the right place, if that makes sense.
Yeah.
And that with the new system, they're really hoping to do what we call closed loop referral. So right now when you call, you would kind of be given a list of like, here's all the people that do whatever need it is that you want. But with this new system, it has a capability to connect you to that resource. So if you call and you're like, I really need help with rent or whatever, then it will connect you to that resource directly, in theory, in the long run. So we're excited about some new things on the horizon with 211.
I can vouch in my time doing this that if somebody in Murfreesboro wants help, it's not hard to get it. What we run into on our side, and I don't want to give a percentage, I'll let Sergeant Wood do that, but majority, we have people, majority of them tell them they don't want help. They want to live this way. Be it mental health consumers, alcohol, drugs, whatever, majority of them want to live that way. So what our job is to let them know that this isn't a place for them to live that way, and try to get them the help they need. He has got bus tickets, he's got housing, he's got all this stuff. There was a girl the other day going to Biloxi had a job and a house waiting on her. So anybody that wants services, it is abundant here.
I will say with the caveat, would you say though that people that you're saying are looking for services are the ones that you guys are interacting with who are literally homeless?
Correct,
Right?
yes,
Because I think
yeah.
when you think about that bigger number.
Yeah, I think that.
I know you're very involved with Boys and Girls Club, for example. We have a lot of families that are kind of in that Alice bracket, and that's where the services, in my opinion, are more limited.
Right. We don't see that.
Right.
Yeah.
You
Unless
see
it's a
people
criminal
that
matter.
are
Right.
literally homeless,
Right.
yeah.
Yeah, John Hinkle, I think, one of my main concerns is it's really people in housing insecurity issues, where Sergeant Wood and I have talked before, about the food issue. If you're homeless, you got food. It's those who are in a housing crisis situation where they're trying to pay their bills, trying to pay their rent, and they're debating whether we buy groceries.
Correct.
That's where I see it the most. I've been to homeless encampments. I've seen bags of food, bags of groceries. That's not a slight on the homeless population. That's just the reality I've seen. It's people who they have 2 kids in school. They're renting a house. Rent continues to go up because they live by the university. They're just trying to make ends meet, and I think that's where my heart goes out to right now. What are those organizations that are working with those people? And I've seen it with Greenhouse Ministry. I've seen it with Still Waters Ministry is another one that are trying to place people to get them settled just settled, because their life is unsettled.
Right.
Journey Home has a food closet, Nourish, Greenhouse, of course. The resources are there. on that part. Like I said, we can feed you, I promise. If you come to me and you're hungry, I promise I can get you food.
Right.
So, but you're talking about, people giving, let's give it to the organizations that'll help. And let's quit wasting money on taking food to camps, because it's a waste of time.
That was kind of the thought behind the signage issue, or the signage thing. And Angela, I don't know if you want to talk about that more than me, but if you guys haven't seen, we've had signs put up around town, and that was the QR code and all that. That was kind of the reasoning behind that, is not only the panhandling issue. No, I don't think anybody wants to see that in our city, but that money you're giving them is not going to what you think it is. And I know I'm a glass half full guy, but I'm just being honest with you, it's not. So that was kind of the reason.
The folks on the corner?
Correct, yes, sir.
Okay.
Sergeant Wood, I've noticed at Journey Home, there's been clients there that have been regular for 10 years that I've been involved. And this last month, I'm a monthly guy, when I was there, they were gone.
Yes.
What's happening?
It's the change. It's, there's still a couple. You just gotta look. They're hiding around the corner.
Okay.
But they're working on it. They're working on, the Journey Home had become a place just to hang out.
Yeah, it's a lot of families now. I saw we serve numerous families and people I didn't recognize. But like I say, we've had people that for 10 years we've served them lunch once a month.
Yes. And there's a couple of those people that they've served for 10 years that we're going to have to find resources for.
Especially mental health.
Yeah, I talked about it with actually Co-Patrol this morning. There's a family that comes every day. And when their 30 days are up, I'm going to have to figure out a way to make sure they get food. And I'll do that. But it's changed, and it's not just a hangout. So that's the good thing. That's the change you've seen, is they're just...
A night and day difference.
That's to their credit. I mean, it was a collaborative effort, but they have put it in motion for sure. And it's in my opinion, what it's meant to be now in the new building and what they're doing. I mean, they have 10 hotel rooms in that new building. I don't know if you saw that, and that is, it's in the name, it's to get them a home, but they're doing a whole lot better.
I think also the true mission of the Journey Home is starting to really show itself now, where it had become, just saw it as a place to get free food.
It's called the Journey Home.
Right. So they help people who were experiencing on the verge of homelessness. I know we had an employee at one of our facilities that we found out that was basically kind of couch hopping and living in their car half the time. And we were able to make connection with the Journey Home. And I mean, that afternoon they were able to help them just, for a little bit, get their feet under them and get back in a house. So the true mission is really starting to show itself now.
Yeah, and one of the first meetings I expressed to them, I said, my son, like most of our kids, has to do some sort of community outreach through his high school. And I said that there's no way that I would let him come to do his service hours here. And then once we started breaking it down to their accountability committee, who's not in there all the time, and giving them data, I mean, I think we had 4 meetings in 3 weeks. I mean, they were changing things immediately.
Rapidly.
And like I said, changing staff and ideologies. So
I think we all have learned that we don't want to be on Leslie Dodd's bad side.
Amen.
I should have known that in the first place. I'm just-
Fortunately, on her good side.
So not to mention any names of organizations, but I first brought up kids, and now I'm going to bring up food, because we have several organizations. And what we have is this pile of money from the city, and it's our job to allocate it into Murfreesboro, to give to the charities that need help, that really do need help. And we have several that are just all about food, and give us a big block of money. And they ask for it, and they put together a program. But what you're saying is that's not necessarily the biggest, or even one of the top 3 biggest needs.
Not for us. I don't know if you can say any different for what your kids see, but.
And what I didn't hear hardly anything about is medical needs, that type of stuff. Kristen, how about?
So I don't have the data off the top of my head, but when we look at the Alice population specifically, we know that there is disproportionately those families are uninsured. And so just like Dr. Hinkle brought up, a lot of times families who are living paycheck to paycheck, a lot of times the decisions that they're making are, can can I buy groceries, can I pay my rent, or can I pay for medications or going to the doctor? And so we see a lot of folks that are probably not getting the care that they need because they either can't afford it or they're not insured.
So you got, what, the Hope Center, and really, that's it?
And you also have St. Louise Clinic, which serves, they're in Murfreesboro, they're connected to the hospital. Not literally, but they're in partnership with the hospital.
We use it a lot. We send people out.
You do, okay.
I think if
So
you're,
that's, yeah.
excuse me.
No, go.
Thinking from a student perspective, putting yourself a little person, because I'm in elementary school, it's about getting home and not being home with anyone. It's about being in a motel or a car or doubled up with another person. They have some of the food, but they may not necessarily have clean clothes.
Yeah.
So as we're looking for ways to support families, we have a resource center on
Great
campus and working
observation.
with social workers. It's about, when we talk about offering rewards or activities, can families get there? Is there transportation for them?
Yeah.
Can they break the cycle? It's about not just giving them the handouts, because what I found over the years, especially with my team, is they'll keep saying, gimme, 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 but how are we teaching families to make those changes? And as you said, some families do not, and we do see that. How do we change that cycle for them, and how do we get them in school the next day? Because they maybe didn't sleep, maybe there was violence going on, maybe there was gangs, maybe there was domestic violence, and these are all things I'm not making up, but just here on a daily basis that our kids are dealing with. And how do you expect them to focus on English and math when they haven't slept? Or they're sleeping on the ground or other places, and those are the types of things we're trying to work with our social workers. We're doing home visits, we're bringing MPD in as well.
See, one of the good things that we got going, and I'm drawing a blank, is it CARE, what's the QR code? CARE, all of our officers are given, hey, there it is, the expert, thank you. So there's something called Handle
the wrong table.
Handle with CARE. You'll see officers will have a sticker on their computer in their car, on the back of their phone, but it's a QR code. They can scan that. If they go to it's something as simple as a vehicle accident where nobody's really hurt, but you could tell the kid was upset and it scared the kid. They can go in there and type that in, and it goes to the city school for the next day. And I don't know who receives that.
So I actually get that email. It's the first year that we've done this.
Wow.
So it's so Rutherford County Schools and Murfreesboro City Schools gets an email. And then we disperse, for our district, we disperse that to the school counselors, and then they check in with the kids just to see what it may be.
Wow. So, it could be something very minor, it could be something very serious. And I'll be honest with you, it's very new to us, so I'm just going to be blunt and honest, it's probably not done as much as it should be yet. But we're getting better. But, if you go to that domestic where, you had a legitimate arrest made out of a house, they can do that real quick, so they get notified for the next day. This kid may not be the same, or might have been late, or might be tired, or,
Traumatized.
Exactly. Something to give them a little bit more than what they get every day, so.
I've lived in a town before that had it for a decade or so. Made all the world of a difference.
Sounds like
I had no idea medical or police or fire or anything was happening.
Yeah.
And just that simple check-in in the morning makes a big difference.
So how does it work? So a police officer uses the QR code?
Yes, ma'am. So you scan it, and it's just a quick, and I have never seen the end, but it's like less
So
than
it's
10
cute.
questions, right? I mean,
Yes.
yeah.
Yeah, so it's just basic information. If they know that, at the very least, it says, the very least is the district or the city they're in with their name, and then if they can identify the school, they do that as well. And then from a school standpoint, then we just disperse it to who needs to have the information.
Yeah, little Johnny was in a vehicle accident, seemed pretty upset. Can somebody check on him tomorrow?
Okay, you guys get that information.
We don't actually get anything in writing besides the kid's name.
That's it.
and
So
the
you don't know
information.
what happened to the
So we
kid.
check in, Yeah.
Oh, you don't get that? You don't get what happened? Okay.
No.
Starts the conversation.
Mr. Montgomery, if I could, we've talked a lot about homelessness. This committee will also receive a lot of different applications from recreation, from arts, from medical, other community needs. What gaps in services or interactions do you have outside of that homelessness? I know Nate has, because of Patterson, the senior center, a lot of different relationships. as well.
Yeah, we have a lot of positive relationships. I think working with the Discovery Center is a great relationship. They offer services that we don't necessarily offer. So I think that's a good example of something that's a beneficial organization in the community that really does great work.
With schools, is there anything outside of kind of that homeless venue that we've talked about? Any organizations that you would want to mention or gaps that you see that really should be addressed and funded?
Yeah, I mean, I think from a school standpoint individually, they're working with their community partners and looking to support the STEAM programs that they're working in. That would probably be one of the bigger ones. So.
That's kind of what they did here over the weekend. We came out for that. Very impressive, by the way.
And then, unless the committee has additional questions, maybe we could wrap up by just, if the panel can share what you want this committee to know, if there's any parting words, ask, or insight that you could share.
I just say I appreciate y'all's work. I know there are a lot of great organizations in Murfreesboro that have a lot of different roles and responsibilities that makes this place really special. I don't envy your job.
I'd be honest with you, I ditto what Nate said, but until the homeless outreach support team started, I didn't know this was a thing, so I greatly appreciate it because it's definitely shown where we can help people that want to be helped other than bracelets and a set. I mean, honestly, and so that's changed kind of our mentality of how we do business, especially with the unhoused community. And I think Sergeant Wood, it's a very, very small ratio of who he has to affect criminal matters to compared to getting them help. So
I will say one thing, I'm not on the panel, but I'm sitting up here.
You're
so.
panelish.
So one of the things that United Way, so obviously we have a unique perspective in that we provide programs and we also support other nonprofits in our community. One of the things, and Sergeant Wood alluded to this earlier, when we give grants, we have really started to put an emphasis on collaboration. And so the grant that he's talking about is a collaborative grant with Coal Patrol and the Police Department and Salvation Army, where they came together and approached us and said, this is how we're going to work together to address this need in our community, which was when the police department comes across someone who needs help, how are we filling that need? And so as you guys are looking at applications, I would just really encourage you to consider how are agencies working together to dissolve problems instead of holding those problems in place. And that's one of the things that we think about a lot when we are looking at applications as well. So just something to think about because the segmentation and the siloing of services does happen a lot in our community. And so you guys have a unique position that you're able to encourage folks through your funding to work together. So that's something I would encourage you around.
And with that grant, we don't just get there has to be an end goal for us to use that grant. It's not just, we're going to get you a hotel for 5 nights. There's got to be, you've got to do something for us to do this.
It's got to be sustainable.
Yeah, and we've had people, though, that'll call and they'll be like, well, the police officer's coming to talk to you, and they'll be like, no, I'm good. And
So when I see on Facebook, like, someone soliciting for people to pay for hotel rooms, is that like, should they be going a different route, or?
Like charity yeah.
I will mention, so we do an event with our local churches, and we do that. We just started doing it last year. And we have our McKinney-Vento families come in, and we provide a hotel room that's decorated. We did it about for 15 families. So during the holiday season, they would have a tree, they'd have some gifts, and they'd have a couple warm meals. So it's something that was nice that we were trying to provide on a regular basis. What we're using as a school district is funds that are being donated to us, and then our McKinney-Vento funds that come in, which are decreasing a little bit. Beyond that, I think it's just for the nicety types of things that we're trying to do.
Collier, you're talking about people just individually asking for donations or on behalf of an organization?
Like a homeless advocate that's on Facebook asking for.
But not through Journey Home or Greenhouse.
Right.
I know my wife's nonprofit, we work with a lot of homeless families, and when they come to us for those issues, we point them back to Greenhouse or Journey Home and let the professionals really work through that.
Because then we can check Charity Tracker to see, they could have had, 5 people could have got them a hotel.
Let me ask you this, where do you send your kids for medical care? I know Hope Clinic, but that's hard to get into. If a child needs to be seen by a physician, where do you send them?
That is a really good question that I should know the answer to.
Okay.
I
mean, because I know pediatricians are hard to get into, and most of them here are private, and you want insurance payment or...
I'll figure it out. I'm letting Angela know.
Or St. Louis does children or not.
I mean, Journey Home has a medical part, I know.
They do, and it's been enhanced with their new facility. So, and they've kind of slow rolled the opening of that, correct?
Yeah, right now it's just Tuesdays, is that right?
Yeah, I
Mark?
believe
think it's
so.
just Tuesday, the nurse.
But they do have volunteer
PA.
doctors.
No, it's Tuesday and Thursday.
They have doctors and nurses who volunteer to come in, and I think that might be a place to start. But
My
I
friend
don't want to
is
speak
a
on,
nurse practitioner, she volunteers once a week.
right. Yeah, I don't want to speak on their behalf of who they will and won't see or treat, but
I just wondered
it's a great question, yeah.
quickly. And the hospital gets pounded, the ER.
Right.
Yeah.
That, just on the, I had one more slide I pulled up, but the co-responder group, the 3, mainly it's been 2. We just added a third probably a month ago, 3 weeks ago. So in that time length that I said earlier, July 1st to September 30th, they had 73 encounters. 22 of those were safety plans were completed. 21 of those were 6404 committals. 12 of them were admitted into the crisis stabilization unit, the CSU. We talked about the thing there. And then 6401 was 8 of them. So out of those, there were 73 things in 3 months that they were dealing with, just needing a licensed social worker, so.
Hey, Carl, can I say something on a personal note? I've had to deal with Sergeant Wood on multiple occasions, and I know the homeless situation. You know, my church is downtown, Colliers Church is downtown. Leela and I live downtown. We chose to live downtown. And I know it is a stress and strain on the city. We deal with it every day. But Sergeant Wood and his team should make Murfreesboro proud. They have on many occasions come to the corner of College and Spring and handled themselves very professionally. It's what you want to represent your city. A lot of people do not know how to deal with the homeless population. His team does. They do a tremendous job. They do it, I use the term, they give pastoral care. They give some kindness. They give some grace. It's not about moving people on. It's truly about what is the best for that individual. And it's not an easy thing to do, but I've always been impressed every time Mark and I are together. I'm more frustrated than he is, and he calms me down. So I just wanted to make that note.
Yeah.
I would say being in homeless camps with Sergeant Wood and his team, like you said, they're treated with respect, but also firmness and fairness as well. First question they ask when you're trying to get somebody out of a tent is asking if Wood's there. So I just wish he was that nice to me. I don't know. Never.
Well said. We appreciate y'all being here. It's very eye-opening, very eye-opening.
Very helpful information for what we do.
And so y'all can hang out and listen to the rest of our stuff, or y'all can leave.
Thank y'all.
And I'm going to take a little break for a second. Are we ready to get back at it? Thank you, Angela. That was appreciate you putting that together.
Yes.
Okay, Board of Trustees update.
Yeah.
You have any money?
Well, we do, but real quick before we do that, you probably all know that Lee Moss, who was on the board, has passed. And so that position has now been filled by Kurt Garrett, who you may know, a banker here for a long time. He was with Volunteer State. He's with,
Yeah.
I'm going to say wrong, First Bank. He transitioned over somewhere.
Kurt Garrett.
Kurt Garrett?
Oh, no.
Yeah, he and his wife own, was it Garage Bar downtown, the pink building? They run that.
You know, he's a member of the
Probably will see.
club.
He?
You know his face.
His face.